In Japanese society, there are many issues the modern healthcare system faces that demand addressing, such as ensuring quality of care to the elderly, reducing burden on medical personnel, and managing rising healthcare costs. Our goal is to introduce a program called Innovative AI Hospital System, which establishes an advanced medical practice treatment system implementing AI and IoT to help solve these healthcare issues. Would you like to know how these innovations can make your next visit to the hospital a more satisfying experience? Let me take you to the front line and show you how.
The purpose of development is to change the way Japanese hospitals work. We offer solutions to both medical staff who are overburdened and the patients who are not satisfied with their care. Medical care at its core is compassion. However, with the sophistication of modern medicine, there is less of an opportunity to practice such compassion. However, in the hospital setting, there are many other labor-intensive tasks in addition to provide medical care, where the use of AI can save much time and energy. First, we are aiming to develop an electronic medical record that can recognize voice and automatic data entry. The current pilot study focuses on reducing the amount of work for nurses in the surgical ward. Currently, 30 to 40% of our nurse time goes into chatting on the patient EMR. By using automatic data entry into medical records, our goal is to reduce working hours and increase patient interaction. Communication is key for everything. It is at the core of hospital operations, and we believe that AI Hospital will serve this exact purpose. The most important point is that the sound must be converted into words accurately. It is one thing to be able to transcribe in a quiet setting where standard language and a smooth tone are used. However, a hospital word is anything but that, often with constant disruptive background noises such as electronic sounds, electrocardiograms, other people's voices, echoes, etc. Therefore, noise removal and speaker separation technologies are required, in addition to sophisticated learning technologies such as the ability to understand medical abbreviation and picking up user dialects. Advancements in the quality of medicine will demand an increase in medical staffing and equipment going forth. However, due to financial constraints, this may not always be a possibility. Furthermore, stricter labor regulation of doctors will be another issue as well. Utilization of AI is indispensable to solve this complicated problem. By automating certain EMR processes, we will be able to reduce the workload for staff, alleviating current labor shortage and improving labor productivity on site, keeping operational costs down. As the next step of automatic entry EMR, our goal is to implement structured notes using a SOAP format, supporting doctors in differentiation of symptoms, diagnosis, and selection of a treatment method. Going further, this technology will be expanded to a nurse's vital sign entry automation, pharmacists' drug identification, and rehabilitation work. In addition, speaker separation technology will allow doctors to automatically input data even in noisy settings such as in the outpatient clinic while obtaining informed consent from the patient. The most appealing point of this project is its real-life uses in the clinical setting. Highly trained specialists can support each other without having to navigate through a hierarchy. In addition, working directly with the end users, they can make suggestions for improvement. For early widespread implementation, we'll focus on the needs of a client to be able to offer the package the best accommodation to these needs.